Hi everyone, welcome to Guts and Girl Bits. I'm joined again today with Lisa Costa-Bir and we're going to be talking about thyroid nodules. So we're going to get a bit more specific about this condition, aren't we? Yeah, so I'm so glad you're back again.
Thanks. I'm so excited to be back.
I know, it's enthralling. So let's just talk about, thyroid nodules. What actually are they?
So nodules are basically we're seeing the growth of tissue. Sometimes it's thyroid specific tissue, but often it's not, forming on the thyroid gland. Yeah.
Yep. So they can be quite worrisome for a lot of patients because they're like, oh my god, what are they? But they're not always something that we need to worry about.
Yeah, I don't think they're always something we need to worry about. A lot of people have them, and the research shows that I think 50% of women over the age of 60 have nodules. So they are associated with ageing per se, but maybe that's just ageing as a result of increased exposure to oxidative stress and inflammation. If they're not causing any problems, then I don't see them as being problematic. It's not like you need to get your thyroid removed just because you've got nodules. If of course they're cancerous, then yes. If they're impacting your quality of life because they're so large that they're impacting your ability to breathe or swallow, then we need to look at what we can do in more detail there.
Yeah, if they're actually occluding your airways or your throat, for sure. So you just take it on a case-by-case basis.
Definitely. And I think that's the beauty of naturopathic medicine, that we do look at everyone individually.
Yeah. And so you said they're pretty common.
They are.
Yeah.
But whether that's normal or not, I think because nowadays we're just faced with so many things that cause inflammation, and maybe from a nutritional perspective we're not consuming enough of the foods that provide us with anti-inflammatory support. Maybe that's in part why we're seeing nodules, because they shouldn't they're a normal thing, but they shouldn't really be there. Yeah.
I guess it's one of those things that you don't know that you have it until you're having a scan because something else is going on. And then if you're generally healthy and well, you're not going to have a scan. So you're not going to know that you've got something going on there. But it could still be your body's way of telling you that something is wrong, but it might not necessarily be giving you symptoms. Yeah.
Definitely.
Yeah. So what are the standard ways of getting it diagnosed?
So usually an ultrasound is what most people have. Yeah. Yep.
And then from there, is biopsy usually needed?
Only if I think there's concern that they might be cancerous.
Okay.
Yeah.
Yep. Would it be teamed with blood tests?
For me, I think definitely blood tests need to be done, particularly as nodules can have their own thyroid hormone supply. So sometimes in people that have hyperthyroid, it's actually a nodule or two that's it's due to a gene mutation, producing its own thyroid hormone supply, which is quite interesting.
Yeah. Okay. So it's like a thyroid within a thyroid.
Exactly. Pretty cool.
Yeah.
It's cool what the body can do.
Interesting, but not great.
Yeah.
Or for them, it's not cool. It's actually quite hot.
Yes. Oh, awful. Yeah.
Yeah. Okay, so the thyroid tests would be standard TSH, T3, T4, but also thyroid antibodies would give you a bit of an indication.
Important.
Yeah.
Yeah, thyroid antibodies are really, really important just to check if the condition is driven by the immune system, and it's autoimmune, in which the management is slightly different. But T3 is really, really important. Often you'll find that endocrinologists and doctors are not testing T3. And it's really, I just can't emphasise how important it is to test T3, that TSH in isolation is actually really unhelpful. Really, really unhelpful.
Yeah. It can be normal for many people with other hormonal imbalances, and it changes throughout the day. So.
Absolutely, it does have its own rhythm, but just for example, yesterday I saw a patient with TSH of 0.02, and you might think, oh, she's hyperthyroid based on that, but actually her T3 was extremely low, and she's got dry skin and fatigue and very, very low heart rate. She's actually completely hypothyroid, her TSH is that way because she's completely stressed out and juggling too much.
Yeah.
But if we just went on the TSH, you know, it would be a mistake to do that.
Yeah. So you can really help to categorize people based on like what sort of area their hormones are sitting in. Like for instance, if TSH is high or low or normal, and then put that with T3 or T4, whether that's high or low, you get an indication about, is it a pituitary thing, is it a hypothalamus thing, is it a thyroid thing, is it a stress thing, is it an immune thing, and then you can fine tune your recommendations based on that. So getting the full picture is so helpful, but it is, you do have to pay for it yourself if your TSH is normal. To go from doing normal TSH to then wanting to test your T3, you have to pay for it.
I've got a GP that I work with who's really good at testing T3 and T4. But I think if you've got a history of thyroid disease, for example, if you've got Hashimoto's, if you're on thyroxine, then generally it is covered, is my understanding. And it's just if you've got normal TSH and no history of thyroid disease that they won't add in T3 and T4.
Okay. Okay, so that might just be dependent on the person and also the doctor.
And I think it really comes down to, it's a Medicare thing, so the doctor might want to do it, but they might write it down there, but the lab won't do it if the TSH is within range.
Yeah. So the funding just isn't there. There's certain criteria that has to be met for those tests to be under Medicare.
Yeah, but as you said, you can definitely order it yourself, and I think it is worth paying. That it's not a huge amount. It's definitely worth doing just to see where you're at. Yeah,
it's less than $50, I think. So. From memory, might be wrong, but it's not terribly expensive.
No, I've had a patient that came in somewhere recently who has been suffering from amenorrhea for 3 years, been diagnosed with PCOS, except when we look at her blood, she's got 0 FSH, 0 LH, and when I took the case history, I was kind of like, this doesn't sound very PCOS-ish at all. Let's test your thyroid, and T3 wasn't tested. TSH was within range. When we tested T3, not much happening there, really low reading, and so that's why she hasn't been getting her period, because you need T3 to ovulate. So it's TSH in isolation is definitely not a be all and end all. Anyway, these nodules.
Back to nodules. Okay, so apart from ultrasounds, potentially a biopsy, blood test for your thyroid hormones, are there any other testing that you might consider for someone, like in terms of even functional testing, just to get a deeper understanding?
Well, I know for me, I'm really big on testing insulin for nodules, because there's loads and loads of research now pointing towards insulin resistance as being a driver for nodule growth. I think you like to test iodine, don't you?
I do. Yeah, I like to do urinary iodine, particularly loading iodine, because it gives you a better indication. So there's 2 options for urine testing for iodine. They've got your spot iodine, which is kind of like just a snapshot, and it's easier to do because you just do one sample of urine. Whereas a 24-hour loading iodine, you actually need to collect 24 hours worth of wee, so it's a pain in the bum to do, and you need to be you actually need to take some iodine before then and see how well your body is eliminating it, because like if it's eliminating a lot of it, then you've got a decent amount. If you're not eliminating it, it's like the body's like, I need this a lot. So you need to do that. You need to calculate your creatinine in that too, which is like your hydration marker. And then I like to combine that with urinary or blood selenium, and also halides can be helpful depending on the person. I don't always do it. It's only if I suspect exposure. So halides is a group of compounds which interferes with iodine. They're like basically molecularly similar. They're in that same group in the periodic table, and it's bromides, fluorides, and chlorides. It's like the main ones, but also arsenic is included in that too. And that can all be done in a urine test, and that could be a potential driver.
That's really interesting, because talking about bromides, is that right, bromides? I remember reading there were in a lot of flame retardants. So on doona covers, on clothes that we, for children, pillowcases and things like that. So we literally sleeping on stuff like that
Yeah.
for 8-9 hours every night.
Yeah, for sure.
That's a lot of exposure, isn't it?
It is, and like children's clothing is a big one because like children's pajamas, unless they're certified organic, are actually sprayed with bromide.
Ugh.
Yeah, which is like, we don't want our children to catch on fire, obviously.
The likelihood of that happening anyway is not,
Yeah,
it's not high, is it?
But new car smell, that's actually bromide you're smelling.
So interesting,
Yeah.
isn't it?
So you've got to really air it out, and if you get a new mattress, air it out. Like put it out. I would say put it outside because not just like the bromides and the other halides in there. You've also got all of the other like plastics and other things in there that will actually sort of dissipate with time. New carpet. Yeah.
So that may be a really,
Couches.
really big
Couches are sprayed with
contributor
that too.
to why we're seeing so much thyroid dysfunction in the last, 20 years. That it's just ridiculous.
I think so. I really do. And fluoride is another one. We've got so much more fluoride, and I think that we need fluoride in our early years for the enamel hardening. But then when you get older, because we get fluoride through food, we get it in green tea, we get it in certain vegetables like spinach, we get it in bread. But so we don't need that additional one once our teeth are already hardened, and then that starts interfering. And then arsenic is in it's actually in white rice.
A lot of stuff.
Yeah, it's in quite a lot of stuff. Yeah.
Yay.
So fun. And then chloride. Chloride is in tap water. It's in pool exposure. People who tend to be in pools quite a lot are often having higher levels of that. But bromide is the one that I find to be the highest in those that I've tested. So it's a bit fun. Yeah.
So something for people that have a thyroid issue, or they have it in the family, something for them to consider to reduce their exposure.
Yeah, for
lots
sure.
of things you can change.
Yeah, because the bromide and basically all the halides and the iodine are in that same group. So if iodine is subpar and then the other ones are higher, then it's going to displace it. But then similarly, if we want to get rid of the other ones, then we need to bump up the iodine to create more space.
Makes sense.
And then you need selenium. So
Very,
selenium,
very important.
is very important, and it's protective against iodine toxicity as well. So that helps with mercury elimination too. Mercury is another one that's often problematic. So we tend to get mercury quite a lot through food, but just dental amalgams is a source. Certain medications contain it. So it's so fun. So many chemicals. Yeah. And then you can also look at your stress hormones. You can do that if you want to, although I'm tending to steer further away from that these days because I do like the Dutch test. I think that can be really accurate, but because I'm always conscious of finances and I tend to work with people who don't really have testing in their budget, I always say that we can tell whether you're stressed or not.
Absolutely. We're taking a really good case history. You can tell whether someone's having issues adapting to their stresses.
You can just figure it out. Do you blow up over things that you never used to blow up over? Are you irritable about things that you didn't used to be, or that you look back on and you go, well, that was a bit silly of me, wasn't it? Then you're probably a bit stressed.
When I first was in clinic, and even I think when we first recorded our first podcast, I was doing a lot of the adrenal cortex stress profile, the salivary testing, but I agree now it's something that I can really tell just by talking. I mean, I still think it's I wouldn't have ever done a cortisol test, or I wouldn't do a cortisol test now if I thought that the person wasn't stressed. It's more about fine-tuning it and going, okay, so what is your cortisol doing throughout the day and what stage of stress are you in? But then where the Dutch test is a little bit better than the salivary cortisol test is it actually tells you how your body is coping with that elevated cortisol response too. And then you get all your other, you can tell about your neurotransmitters and your other hormones and other metabolites and nutritional stuff too. So that's good, but it is expensive. So it just depends on how much information you want to know. Yeah. Okay. So then that's kind of the testing options. So we've got that information, and then that can help us to narrow down then what are the actual causes of the thyroid nodules, because there's 5 main sources of causes, isn't there? Yeah, I mean, I'm sure there's probably more, but the main things I've seen with nodules are the main causative factors, nutritional deficiencies, in particular selenium and iodine. Hormones, particularly estrogen, as a growth factor. So there are estrogen receptors located in the thyroid gland, and so again, fluctuations with estrogen can cause growth. What else contributes? Environmental toxins that we've talked about, BPA, etc. And then the big one for me, insulin resistance. Huge. I mean, it's something I've looked at a lot. With insulin resistance, there's lots of studies now showing we're seeing lots of people with insulin resistance, higher rates of type 2 diabetes, and we've seen this increase in nodules. And what they've noticed is that a lot of people that have type 2 diabetes and insulin resistance also have thyroid nodules, and when they're given metformin, which is standard medication for insulin resistance, it improves insulin sensitivity. When they give metformin in combination, so this is really important because all the studies just say metformin does this, but metformin was given in combination with weight loss, like a diet, a healthier diet and exercise, which resulted in weight loss. What they noticed was that the thyroid nodules reduced in size, thyroiditis decreased. So basically they can see that high insulin increases insulin growth factor, which increases the thyrocytes, the thyroid cells. So by decreasing insulin resistance, you see a decrease in nodule size and growth, which is really interesting.
That's so fascinating. So there's links there that previously people wouldn't have really connected.
So this is research that's really only come out in the last couple of years. It's very interesting.
Oh, brand new. Yeah, okay. So the diagnosis of insulin resistance, what are we looking at?
So really easy, blood test. First thing in the morning, fasting. Done it as pretty soon after you wake up, and it's that simple. It's free, which is really good.
Well, under Medicare.
Under Medicare
in Australia.
Yeah.
And so it's specifically insulin.
Yes.
So sometimes, like, I've had people said, yes, I've had my insulin checked, but they're thinking about glucose.
Yes, so serum glucose is different because obviously it's just measuring what's in the bloodstream, and basically a good measure of what you've eaten last night. So a bit different. And HbA1c is different again. It's measuring your blood sugar control over a few months. But insulin is quite useful because the nodule growth can occur not only due to a poor diet, so a diet where it's not blood sugar regulating, but you can also see high insulin in conditions high stress conditions essentially, where there's large amounts of sugar being dumped in the body to run away from that stressor, like the lion or tiger. But what we find is that there's no lion or tiger, so we're just seeing those high insulin levels. So we see that in really stressed out people. You even see it in people with Graves' disease, hyperthyroid. So they can be having the most beautiful diet, but because their body's in that fight or flight, it's working double time, you will very often see high insulin. So then you see the nodule growth as a result of that.
So it's not just diet, it's the stress connection with that.
Yeah. So in my clinic, I'm looking at those factors and trying to remedy those across the board. Okay,
brilliant. So there's so many ways that we can work on stress adaptation. Maybe we'll do that later. Okay. Yeah, cool. All right, and then the inflammation component. So what are the major drivers of inflammation for these people?
Nutritional deficiencies, and I think we just see thyroiditis in a lot of individuals. So with Hashimoto's, with Graves' disease, with any the nodules, you're seeing that inflammation, oxidative stress, and that's causing the nodules to grow.
So would things like, you said nutritional deficiencies, but like an inflammatory diet, like high refined foods, junk foods, like trans fats,
problematic.
That sort of thing.
Well, it's not, it's definitely not going to be reducing inflammation or healing the thyroid in any way. In fact, it's going to be doing the opposite.
Okay. What about infectious drivers of inflammation? Like
definitely.
Infections?
So viral infections are definitely a cause of some, thyroiditis. So definitely could be the case.
Yeah. Okay. Cool.
Again, I guess with viral infections, if it is like a long-term one like Epstein-Barr or cytomegalo, we're really thinking that the majority of the population actually has those viruses, but aren't, maybe, you know, don't have nodules or Graves' disease. So it's really about, again, improving the overall vitality, the vital force of the person as a whole, to dampen down those viruses so that they can't be reactivating and causing the problems.
Yeah, that's right. So get the gut right, get the stress right,
exactly,
get the nutrition right.
Yeah. Similar theme, right, for most conditions.
Yeah, that's it. Okay. What's the standard treatment for thyroid nodules for conventional medicine?
So for nodules, I think generally if they're not humongous or anything like that, then it's just to leave them and let's see what happens. Although some endocrinologists do recommend just getting them out because they feel like they're going to grow bigger anyway, so you should just get them taken out now. But yeah, it's really, nodules are there, leave them or cut out the thyroid. Yep. Or just,
cut out the thyroid,
which is, it's not what I would recommend unless, you know, they were cancerous or something like that, or causing difficulty with breathing. It's a very important
so you'd take a more conservative approach?
Definitely. Yeah.
And
I guess I take a more conservative approach because I see the way a lot of people struggle when they've had their thyroid removed and trying to get medication dosage at that right level without getting a lot of the side effects. I see them struggle where maybe they didn't need to get it taken out at all. Yes. Especially now knowing this information with insulin resistance, maybe if we just change the diet and so on, adopted a, let's just check every 6 months to see if the nodules have actually grown, and maybe they've not, and they've actually decreased in size. Well, we don't need to if they're not cancerous.
Just keep going along that path. Okay. And in terms of the naturopathic treatment, so, you know, we've said, you know, we want to be more holistic and look at all those different drivers, the causes. So we're very much about treating the whole person and treating the cause. So we've talked about the causes already, but then are there other areas that we would be looking at to treat that?
So for me, I'm always thinking definitely saturate the body with good nutrition, lots of nutrient-dense foods so that there's no nutritional deficiencies as a causative factor, and there we're reducing inflammation too, so we're kind of killing two birds with one stone. And then, you know, that same sort of diet, whole food, very nutritious diet, very high in fibre, which means it's going to be blood sugar balancing, is also going to deal with that insulin resistant component if it is being driven from that perspective. So automatically we're, you know, just through making changes with diet, you're making improvements in various aspects of the case. Yeah,
cool. Okay. Would you also look at gut health too? Because I know I would.
Yeah, I think gut health is always really, really important. I think a lot of naturopaths start with the gut. Yeah. In my clinic, I start with stress adaptation. I do things in a different order, and that's only because a lot of the research shows that when we're in a sympathetic dominant state, it actually changes the microbiome considerably. Okay. So, but I think we're always working on the gut straight away anyway when we're doing the dietary stuff, right? Yeah. So automatically we're changing the microbiome just by doing that.
Yeah. But the foods that we eat and like the way that we're feeding the bacteria and reducing things that are going to be harmful to them. Yeah. And then working on stress.
I know, I keep going back to it, but there's a really horrible study I looked at years ago, which they had little mice and they put them on a sandwich toaster. It was awful. I know. And they looked at their microbiome before, and then putting them on the toaster was hot, and so it stressed them out, and it changed it. That just those few seconds of high stress changed the microbiome, so there was an increase in pathogenic organisms and a decrease in beneficial bacteria. But I always think about this if we extrapolate to human beings. You know, if we're waking up, thank God we're not being put on the toaster, but you know, the alarm going off and thinking, oh my gosh, I'm late, or I've got all this stuff to do today. A lot of people go straight into fight or flight. physiologically, like it's the same sort of thing.
So
how is that impacting the microbiome? Because a lot of patients come to me and their diets are meticulous. They're so lovely already, but they haven't got the stress adaptation quite right, and they're wondering why they've still got a lot of issues.
Okay.
Yeah.
So I guess the way that we go about supporting that is, herbs. We can talk about that. And then some lifestyle stuff too. Yeah. What's your favourite lifestyle techniques for reducing stress?
Laughter. Yeah. And just fun.
Yeah.
Having fun. For a lot of people, that's when I ask them in clinic, they kind of become a bit silent because they're not sure what that is anymore.
Yeah, like, what do you mean?
Yeah. So
do adults have fun?
Well, hopefully we do. Yeah.
No, that's good. I think that's so important. So what do you like to do for fun?
What do I like to do for fun? I like watching Netflix. Yeah. I like looking at memes and funny stuff. I actually love TikTok. Social media. It's all these people doing dances to songs for about 30 seconds. It's actually very enjoyable, and then so me and my daughter then try to make up our own dance routines to this music too, which is quite funny if you see what I look like when I'm dancing.
Probably better than me.
Oh, I don't know about that. I love reading studies. I enjoy doing that.
Yeah.
I love cooking. I like doing a lot of things. Gardening.
Oh,
yeah,
beautiful.
working. I actually like working.
Yeah. Well, we are in an industry that is fairly enjoyable.
Yeah.
We're very lucky. So that's, I'm the same. Like, I quite like reading my old herbal textbooks and learning about herbs in more detail and getting to know them and that sort of thing.
Yeah.
And at the moment I'm playing Borderlands 3.
Well,
that's my fun.
I don't know what that is.
No, it's a PlayStation. Well, I'm playing it on PlayStation. It's a video game. Yeah. It's very nerdy.
Oh. Whatever makes you happy, right?
Yeah, whatever floats your boat.
Yeah.
And then, I also like the memes. Do you know, when I was younger, I used to call it mermaids. They just, my friends used to, my friends used to just let me do that, and then they would laugh at me, and I'd be like, what?
Yeah, so I think, trying to get more of that in is really, really important, and just seeing the beauty in life. So, sometimes when I'm driving, I'll see a flock of birds, and I just think that's really beautiful to see them. Or if I'm at the beach and I can see I'm at the dog beach and the dogs are running into the water and they're so happy about, they're chasing it's the same ball, the person's throwing the ball again and again, and they're just so overjoyed about getting that ball and bringing it back, and the same thing. I just think that's just really beautiful to see how happy they are.
I love that. And the more you practice that, the more your mind goes to it as well, the more you'll see it and the more you'll dwell on that. It's a bit like if you were trying to avoid complaining or trying to avoid negative thoughts, the more you complain, the more you think something negative, the more your brain will bring that up for you, because it's like, I'm just doing what I'm programmed to do. So if you just practice positive thinking and thinking about the beautiful stuff and noticing them, like when you smell the roses, what do they say? Yeah.
Because, I think life's quite good most of the time.
Here it is.
Yeah, here it is, definitely.
Yeah, that's right. Okay, and so herbs. Speaking of passions and lovely things.
Yes.
Yes. So how do you go about working with thyroid nodules on a herbal level?
Okay, so as far as I know, there's no studies on specific herbs looking at how they decreased nodule size or incidence or anything like that. So I'm really just using the herbs, applying them to the factors that we have discussed in terms of nodule drivers. So if we see that insulin resistance is a driver, then I'm doing the dietary stuff to reduce insulin resistance, but I love to use St. Mary's Thistle, for example, which is just so good at improving insulin sensitivity too. It has multiple other benefits for patients, so I really like that one. Because we saw that metformin works, because metformin works at decreasing the size of the thyroid and decreasing the nodule size because of its insulin balancing properties, then we're using herbs that do that same thing.
Yeah.
So I haven't used them, but hypothetically I assume gymnema would work well,
Yeah.
goat's rue,
Yeah.
etc. And then stress adaptation being a big driver. 2, I'm always using the adaptogens. So in a patient with Hashis or hypothyroid, withania would be a top priority. But in maybe a hyperthyroid Graves, a nervine like lemon balm is where I would go to try and slow down that thyroid function, which in turn would reduce the inflammation, therefore decreasing thyroid nodules. Yeah.
And lemon balm having an antiviral component to it as well would be indicated if they do have that as part of their picture. So that's lovely. And things like motherwort, one of my favourites for supporting in the hyperthyroidism tendencies. It's really good nervine, really good for palpitations that you often get when you've got overactive thyroid, and it's very settling. It's quite fast acting too for the nervous system, which I like. And then what about Nigella? I know you're a fan of Nigella.
I do like it. Delicious. Yeah, so very much using it now to support thyroid function for individuals that have Hashimoto's and hypothyroid. I love it actually, really good there.
Yeah, and that's actually quite helpful for blood sugar level regulation.
I didn't know that.
Yeah,
great.
So that might be one of the mechanisms that it's acting on too.
That's good to know. Yeah.
I actually use a lot of Nigella because I love it for its histamine lowering effect.
Oh, interesting.
So I mean, going off topic, but I love working with clearing the histamine for estrogen dominant issues, and because there's the histamine estrogen link, the estrogen will be feeding the thyroid. That might be another mechanism behind it as well.
Interesting.
Yeah.
And now I'm going to talk about saffron because I read a paper today which it was in rats, but it was saying that saffron actually decreased histamine production. Yeah, histamine release.
Well, there you go. I'll use that again. That's so good. Good old saffron.
Yes.
Yeah. Okay. Is there anything else that you wanted to talk about, or any other stress reduction techniques you might suggest for people?
So with nodules, stress reduction I think is really important. We've covered some of those recommendations in other podcasts, but I definitely think green space and blue space, so water and trees and all that sort of stuff is very healing for everyone. Hydrotherapy has been shown to be very useful for the thyroid gland. So applying hot and cold compresses to the actual thyroid has been shown to reduce thyroiditis and inflammation, so I think that can be very, very beneficial. My passion is actually giving my patients really practical, realistic things they can do while they're sitting on the couch at home, which don't cost a lot of money, and I guess empower them to take their health into their own hands so they're an active participant in their journey. And I think things like hydrotherapy are great for that reason.
So you're not talking about like ice packs with hydrotherapy, you're talking about like water saturated like cloths.
So they're just using compresses, hot and cold compresses, which is really clever.
Very, very old school naturopathic techniques,
which I love.
Nice.
The other thing that's been shown to be quite good for, I guess it's not nodules specifically, but for that thyroid autoimmunity, or really most autoimmune conditions, is in the infrared saunas and infrared saunas.
Okay. Cleansing and detoxing the system,
reducing inflammation considerably.
So I mean, you can find a place near you that has an infrared sauna.
They're popping up everywhere, aren't they?
I know some people that actually have got some in their own house. They love it so much.
The dream.
Imagine that.
Yeah, amazing.
Okay. Yeah, and then what about dietary removal of certain foods? Like, we know that gluten is often associated with thyroid antibodies. So is that a recommendation of yours?
Yeah, it pains me to say it, and I think I'm a little bit, it's hard for me to say it because I still have a little bit of gluten, and I was able to reduce my thyroid antibodies doing it. So I think it always comes down to, why has that person got the autoimmune disease in the first place? But definitely the research shows that gluten-free diet does lead to a reduction in thyroid antibodies. So, I mean, it does work, it does help. it's not going to be the only thing. Like, there's plenty of people on a gluten-free diet and their antibodies don't move. So it's about ensuring that we're putting together all the pieces of the puzzle. But yes, it's definitely helpful. It's definitely going to reduce inflammation. Again, I think we need to talk about gluten-free isn't necessarily the healthier diet if you're choosing inflammatory gluten-free products, right?
Yeah, what are you substituting it for?
Exactly. So I think maybe unless you're a celiac, in which case of course you've got to remove all gluten, for some people with, say, Hashimoto's, it is a healthier choice to be choosing a good quality sourdough rather than a very processed gluten-free bread that has 30 ingredients in it, including multiple emulsifiers, which we know have been linked to increased intestinal permeability. So it's about being able to decipher when is gluten-free not actually the healthier choice.
Yeah, okay, great.
And so gluten-free, I think, is just going to reduce inflammation if it's done properly.
Yeah, if you do it and you don't substitute it for something junky.
Exactly. So lots of fruits and veggies, lots of herbs and spices, lean proteins, and if we're choosing animal proteins, using grass-fed rather than grain-fed, because they've been shown to have a different omega profile, which is less inflammatory.
Nice.
Yeah.
Yeah. Great. So I think that's pretty much it, isn't it? Yay! Thank you so much.
My pleasure.
Yay! So thanks everyone for watching. See you later.
Bye.